The Finance Committee, as the chairman indicated, is focusing this week on issues dealing with the lack of high-quality PPE and other equipment during the pandemic. Now, the chairman has made the focus China, and China, and China some more. And I want to be clear. I agree that counterfeiting is a problem. What I also want to point out is if you're focused entirely on that aspect of the issue, you skip right past something that is much bigger, which is the Trump administration's casual disinterest in leadership when it comes to getting PPE and making sure that our healthcare heroes are equipped. And it goes back quite some ways. Now, the chairman said that Democrats just are spreading doom and gloom here. So what I'm going to do just for a few minutes this morning is spread some facts that are not in dispute. In 2019, the federal government conducted a pandemic war game called Crimson Contagion. In it, a hypothetical airborne virus originated in China, made its way to the United States, infecting 110 million people and killing nearly 600,000. The exercise concluded the United States would need 3.5 billion N95 masks to fight a large-scale pandemic. The Trump administration took no action to acquire them. The coronavirus arrived just months later. On March 19th, 2020, with the cases beginning to go skyward, the president said the following when asked about buying and distributing PPE, and I quote, "The federal government not supposed to be out there buying vast amounts of items and then shipping. Governors are supposed to be doing it," unquote. On March 29th, Donald Trump said nurses and doctors actually said this, were stealing PPE. He said, and I quote, "Something is going on. You ought to look into it as reporters. Where are the masks going? Are they going out the back door?" In mid-April, Donald Trump called reports of PPE shortages fake news. On May 6th, a nurse told reporters gathered in the Oval Office that the availability of PPE was sporadic. Donald Trump said, and this was in the Oval Office, Donald Trump said, "Sporadic for you, but not sporadic for a lot of other people. I've heard we have a tremendous supply to almost all places." Just last week, Donald Trump said, "My administration currently has 0 unfilled requests for equipment or anything else that they need from the governors. We are stocked up and ready to go." So, those are the facts, and the statements that the president has made are just wrong, wrong, wrong. In the last few days, the Democratic Finance Committee staff has gathered direct accounts from healthcare workers around the country about PPE shortages that devastate communities given the recent spikes we've seen across America. The committee, for example, heard from nurses in Dallas, Texas, where COVID cases are surging, who recently began buying their own surgical masks since their hospital was requiring staff to reuse old ones for days at a time. The committee heard from an administrator of a 33-bed hospital in rural Alabama, serving a majority Black community, who told the committee her hospital is so low on PPE that she keeps an emergency supply stashed in her office for safekeeping. One Oregon home health care nurse who didn't want to provide their name for fear of retribution from an employer told the committee they have so few disinfectant wipes that they're cutting them in quarters to last through the week. Imagine that, cutting disinfectant wipes in quarters because they're going to last through the week. Finance Committee Democrats want to make sure these important stories still get heard, so I encourage doctors and nurses and first responders and nursing home staff that's dealing with shortages and defective equipment to submit personal stories for the hearing record at ppeshortages@finance.senate.gov. If we've learned one thing, it's getting these stories into public view and in front of senators can really make a difference. This week, the National Nurses Union released a survey of 21,000 hospital nurses. 87% of the nurses reported having to reuse PPE that's designed for one use. According to data from the Centers for Disease Control, hundreds of nursing homes didn't have PPE in mid-July, and thousands more had less than a week's supply. States like Oregon, cities, and healthcare providers have been forced to compete against each other and pay a real ransom for equipment on the open market. This has opened the door to junk sold by scam artists and incompetent vendors. A group of health systems was so concerned about losing access to PPP that it actually bought recently a minority stake in a big PPE manufacturer just to keep the pipeline open. So the question becomes, and we've got a lot of senators who represent areas with small hospitals, what about the small hospital and the independent doctor's office and nursing homes that can't afford to go out in the open market and buy their own manufacturer? Trump administration has touted Jared Kushner's Project Airbridge as a PPE game changer, but Project Airbridge brought in just 4.5 million N95 masks over the course of 3 months this spring. The Department of Health and Human Services estimates, this is the Trump administration, their estimates said that the United States needed 300 million N95 respirators every month. The fact is, these shortages of PPE have put our doctors and nurses and caregivers in grave danger. An ongoing study by Kaiser Health News and The Guardian has identified at least 851 deaths among frontline healthcare workers, likely due to COVID-19. From sea to shining sea, Americans are desperately hoping now that there are going to be safe and successful vaccines on the market in the coming months. And when we have those life-saving vaccines, we're going to be working for a fair and methodical and medically sound way to distribute them. Unfortunately, the country's experience over the past few months, particularly with PPE, raises serious concerns about whether or not Americans can have confidence this administration will handle things in that fashion. So there's a lot to talk about today. Before I wrap up, I would ask unanimous consent. I gather, Chairman Roberts, you're going to be running things. So Kansas is out there on both the majority and the minority side. Mr. Chairman, I ask unanimous consent to enter statements on PPE shortages into the record at this point.
Without objection, it is so ordered.
And one last thought, Mr. Chairman. I want to also thank Chairman Grassley for adding at our request this second hearing on this important topic. We requested it because we felt it was important to hear directly from people who are on the front lines having to face these kinds of difficult choices. And I would just like to close by giving a thanks to Chairman Grassley for agreeing to hold the second hearing on the topic. Thank you, Mr. Chairman.